Hello. In this lesson, Seeing the Flaws in the System, we will define terminology related to near miss and error reporting and introduce two major radiation therapy accidents. There are quiz questions embedded in the presentation, so be an active listener. What is safety? Patient safety is defined as the avoidance, prevention, and amelioration of adverse outcomes or injuries stemming from the process of healthcare or freedom from accidental injury. It is related to the Hippocratic Oath taken by physicians to first do no harm. What is a medical error? In 2005, medical errors were the leading cause of death in America. In that year, it was estimated that between 44 and 98,000 patients died as a result of a medical error. It was also estimated to cost between $17 and $29 billion per year in lost income, household production, disability, and additional healthcare costs. Fortunately or unfortunately, the definition of medical error differs depending on the context. The term medical error means something slightly different when related to research, quality control, or ethics, for example. There are also many surrogate terms, including noxious episodes, iatrogenic illness, and critical incidents. Another definition is the failure of a planned action to be completed as intended, an error of execution, or the use of a wrong plan to achieve an aim, an error of planning, an unintended act either of commission or omission, or one that does not achieve its intended outcome. Divisions from the process of care, which may or may not cause harm to the patient. Reason's Swiss cheese model of error causation illustrates the pathway to medical errors from hazards to losses. As you can see, the holes in the cheese or the conditions surrounding the hazards must line up exactly for the hazards to cause losses. Hopefully, there are preventative measures or whole cheese in place. A simple definition of medical error is an act of omission or commission in planning or execution that contributes or could contribute to an unintended result. Let's look at a few other related terms. An adverse event is an unintended injury to patients caused by medical management rather than the underlying condition of the patient that results in measurable disability, prolonged hospitalization, or both. Unintended injury or complication that results in disability, death, or prolonged hospital stay and is caused, including acts of omission and acts of commission, by healthcare management rather than the patient's disease. Near misses are more likely to occur in radiation therapy. A near miss is any event that could have had an adverse patient consequence but did not, and was indistinguishable from a full fledged adverse event in all but outcome. Importantly, these terms carry with them stigma that can evoke feelings of guilt, anger, inadequacy, and depression among those who commit the errors. There is also a threat of legal action that compounds these feelings and perpetuates a culture of blame. A couple of industries provide models of safety for radiation therapy. Many of the current initiatives are modeled after the aviation industry, which is touted as the gold standard for safety. Another is the nuclear power industry. Both industries have good reputations for safety and few accidents, at least that make the news. Potential radiation therapy errors include unintended exposures of staff and the public, tumor underdose, normal tissue overdose, target volume misses, and unintended exposure of critical structures. Note that the purpose of radiation therapy is to adequately target the tumor and spare the normal tissues. Any of these errors can be random, meaning they occur in one off situations, or systematic, meaning they are repeated. The American Association of Physicists in Medicine, Task Group 35, report outlines medical accelerator hazards by type, cause, and consequences. You can see, for example, that electrical issues, software malfunctions, or therapist error may cause the incorrect dose to be delivered. This can result in serious injury, increased complications, genetic effects, a second primary tumor, and compromised tumor control for the patient. So, how common are errors in radiation therapy treatment delivery? Studies suggest that approximately 1% of patients have at least a minor deviation during their course of treatment, with the majority causing no lasting harm. It is difficult to obtain information about radiation therapy accidents because of the medico legal climate. Obviously, facilities and equipment vendors are not eager to see negative publicity, and the effects of the errors are often insidious. It may take months or years to discover the cause of the actual error. We will conclude this part of the lesson with a discussion of two prominent radiation therapy accidents, the first involving Scott Jerome Parks and the second involving Alexandra Jen Charles. The two were patients at separate hospitals who incurred catastrophic accidents and died as a result of their injuries. Let's remember them both as we focus on our reasons for near miss and error reporting.